Welcome to Fellowship Safaris, conversations about people of color and their journeys to subspecialist training in their countries of origin and around the world. Hi, everyone. Welcome to Fellowship Safaris podcast. Today, I have the privilege and the honor of talking to one brilliant individual who I've had the pleasure of getting to know. And now that we are moving into different subspecialties, I'm really excited about this conversation because she's going to be the first of the subspecialty she's going to be telling us about on the podcast. And before I get ahead of myself, I'm going to give her a moment to introduce herself and what her professional qualifications are.
Thank you, Njeri. My name is Dr. Susan Nabulindo. I'm a medical doctor with a specialty in anesthesia and critical care. And I further subspecialize in pediatric anesthesia.
What made you fall in love with anesthesia and guide you in that direction?
Yeah, thank you. That is a very long journey. And I remember when I was in medical school at third year, I used to wonder. I didn't know. I actually by then did not know any of the specialties. But going through the rotations in undergraduate, what caught my eye so much was critical care. So later on, I learned that in my country, the practitioners who ran ICUs were actually from anesthesia. So that is how comes I made a decision, because anesthesia was going to give me a chance to practice critical care medicine. And I also wanted a specialty that I could meet and interact with a wide range of patients. So anesthesia looked attractive in that way.
What I'm hearing you saying is that patients were a huge part of that attraction to critical care. And what else about being in the ICU caught your attention? I hear patients being one. What else about it really grabbed your attention?
Yes, the fact that there was too much happening in one setting. And you could have a patient who was so sick, especially acutely sick, and they would be taken care of and they would be okay in a short period. So that adrenaline rush of being able to treat very sick patients and you actually see them come up was quite attractive to me. And I think part of it was having spent a lot of time in the emergency department during one of my rotations. And to me, I wanted something where I did the work, worked on the patient, and I could see results immediately. And anesthesia actually gives you that.
I hear you in terms of wanting to see this immediate sort of effect. Whereas there are some specialties, like my subspecialty, I have to accept that there will not necessarily be an immediate effect. And so it's really interesting to just hear that that was one of the things that pulled you. And in the beginning, you mentioned anesthesia and critical care. How long did it take to do that initial training in your specialization?
It took 3 years. When I trained, the training was being offered for 3 years, but subsequently it was turned to 4 years. So you require 4 years of postgraduate training for you to be an anesthesiologist and critical care specialist.
How long after doing the anesthesia and the pediatric critical care did you start thinking about a subspecialization in pediatric anesthesia?
This took about 4 years, 3 to 4 years. And after finishing my specialization in anesthesia, I actually had no idea I was supposed to think of a subspecialty. All I was thinking about is finish and work like everybody else and enjoy the new addition to my career. But after about 3 to 4 years, the reality of now learning that there are actually areas of subspecialization in anesthesia, then I started thinking about what do I need to do. So my initial backfall because of why I came to anesthesia was I thought I would actually go and subspecialize in critical care. Okay. But while I was still thinking about that, there was no subspecialty training going on within my country locally. So looking at it, that was going to take a bit of time coming up. So while I was still thinking about that, there were talks of pediatric anesthesia, and part of what I had actually wanted to do at undergraduate was pediatrics. And when I was working as an anesthesiologist, I was actually posted to work in one of the busiest tertiary hospitals. And I spent most of the time, every Monday of the week for 3 years, I actually spent in the pediatric surgical operating theater. So I realized that I actually loved working with children. Even this was coming from an anesthesia point of view. So that now ignited my passion and thought about going into pediatric anesthesia, and that is how I ended up shelving the idea of critical care and actually thought of pursuing pediatric anesthesia.
I'm happy and yet sad because you're like, oh, I was in love with pediatrics. I was like, we almost had you in our subspecialty. And at the same time, I'm so glad that from our work perspective, you ended up getting so exposed in terms of pediatric anesthesia. And, we are so happy for those Mondays that happened. One of the things that you have mentioned is that there was no local fellowship available. So how did you figure out what you were going to do and where you were going to start looking for this training?
I must say that the stars were shining on me. I had not even started thinking of where to look for a pediatric anesthesia fellowship. I worked with 2 senior pediatric anesthesiologists, and those are actually part of the people who I interacted with, and they talked about where you can train and what it involves. So I had done that background check just from senior people who were already there. And while I was doing that, before even I started thinking of searching, one of the local institutions, universities, actually started talking about starting a fellowship in pediatric anesthesia. And that is where I was employed. And I sat in some of the meetings where the curriculum was being developed, where the program was being developed, until within about 2 years, that became a real pediatric anesthesia fellowship. So when that happened, I stopped any thought of going anywhere else because it was here.
Truly, the stars were shining on you. And you were even in the room when that curriculum was being developed. And I think that's so amazing and speaks to just having, quite literally, your path ordained in the direction of pediatric anesthesia. And as you were trying to figure out what you wanted to do, and as you were continuing to, hone your skill as a subspecialist, tell us about mentors and people that you interacted with and what was most impactful, apart from getting the information of like potential places where you could do the fellowship. What was most impactful in terms of mentorship during that period of time for you?
Yes, I am one of those people who was very slow in picking up mentorship in my career. But thinking about it, I should say probably I did follow people quietly without officially announcing I'm your mentee. Among the people that I worked with, I looked at how they did what they did. At that point, just a handful of pediatric anesthesiologists, and the 2 senior ones I worked with almost on a regular basis became the people that I looked at. How they handled children was very different from the rest of us, and how the discipline they had around taking care of children was very, very important. So looking at what they did, speaking to them, actually gave me clarity on exactly what to expect. And they shared their stories, including what the challenges were in their practice. Yeah, so I remember one of the main things we discussed at a point was the issues of medical legal problems when it comes to pediatric anesthesia, because you are treating not just one patient, but the parents and the family. And that was one scary thing. But again, the reassurance that once you are trained as a specialist, the likelihood of getting into that line is very low. So mentors really helped me have clarity and understand exactly what I was getting into.
I absolutely love that. And a big shout out to the people who initially didn't know that you were observing them and just learning from them silently. And you've mentioned medical legal as one of those things that came out in terms of the challenges. What were the other challenges, if you're comfortable to share, that they shared with you in terms of what to anticipate as you're learning and as you'll transition into practice as a pediatric anesthetist?
Yes, one of the biggest challenge, and they shared, and what I can also share now from my own experience is the loneliness of being a subspecialist in a region or in your country where you are very few. You come back, you are trained, you know you are a specialist, but the acceptance and support among everybody else who does what you do becomes a challenge. So it requires a lot of believing in yourself and being consistent over time. Yeah, so their resilience was also one thing that I looked at. One of the things in those early days is they had to set standards, and there would be like one person fighting to put a message forward. This is the way we are supposed to do things in children versus how we do it in all other age group of patients. And they had on the other side a big group of people who were used to doing what they were doing. So, but you would see the persistence. I remember one of them saying, if I do this for one patient today, then that is enough. And with that consistency, actually, I observed things changing just by one person being consistent in what they wanted to do.
What was the actual training experience like for you?
As I had alluded earlier, I was very lucky to be in the pioneer class of the Pediatric Anesthesia Fellowship locally in my country. And how it was structured was we were three of us in the pioneer class. So this particular fellowship was actually funded by the World Federation of Societies of Anaesthesiologists in partnership with one of the local institutions. We were supposed to rotate, or rather we were placed in about 5 hospitals locally. So these were chosen according to what strengths they had in terms of training. So you would have be in one hospital probably doing general pediatric surgery. You'd be in another center probably learning about regional anesthesia in children. You'll be in another center which was probably strong in anesthesia for children with cardiac disease. We were placed in those particular hospitals for the 1 year of the fellowship. Then most of it was actually in country. Initially, we had a lot of international faculty coming in from the US, from the UK, from Australia, and they would come and spend with us 2 weeks in addition to the local faculty. So we also had at the end, personally, I was, after finishing the 1 year, I had a placement in the US in 2 of the pediatric hospitals for 3 months, and I continued the learning. So I extended my learning to 3 years to get the experience out there. And that was actually quite an addition to what I had already learned. We also had a project. So everybody picked a project to run with, not like a thesis dissertation, but just a clinical project to work on through the year. So that was part of what was expected of us. Actually, at the end of the fellowship, we did a comparison with other fellowships globally who we had been working with. And we found that actually the amount of work and the mixture of work that we actually got locally was far much higher and involving than most of the other fellowships. So that gave us a lot of confidence in what we were doing.
Oh my gosh, I did not realize just how much went into just ensuring that you got that kind of exposure. When you say funding, what did that mean, for you in terms of not necessarily the amount, but what was covered for you guys if this was a funded project?
Yes, so the World Federation of Society of Anaesthesiologists actually were the domicile organization for this fellowship. Okay, so they were providing the majority of the funding for the fellowship. So each fellow actually got the tuition fee. Just to mention that in this particular institution, you are expected to actually pay tuition fee, unlike most of the other fellowships where that is usually not a necessity. So they paid tuition fee for each fellow. Then they paid for travel because it was a fellowship that was inviting even people from away, especially East Africa. So they provided for travel, coming and going. And then they provided for any trips that were fellowship related. They paid for any conferences or workshops that you had to attend during the fellowship, and any projects you did and you required funding, then that was provided. And then there was a monthly stipend to help you with your day-to-day living expenses. So it covered actually a very big chunk of what you required. It was a very, very favorable arrangement. And again, personally for me, the addition to the funding was my employer actually allowed me to be on salary while I was continuing. So that worked well for me. So initially I had thought about taking study leave versus continuing to work. But when we sat down and had negotiations, then I was able to be actually going to a very good arrangement with the employer. Yes, so apart from that, then there are other institutions, organizations which came in to support globally. So we were 3 fellows. During the fellowship, around somewhere, one of the fellows was picked by one organization, and apart from what WFSA was providing, this particular organization took care of one fellow. While we were in the middle, another organization came in and actually took care of another fellow. So the funding, I believe, because of the Pediatric Anesthesia Fellowship being the first one in the region, then attracted a lot of partners, and that favored the fellows very much.
That's amazing. And I think one of the most interesting things that we're seeing sort of unfolding is the world understanding that Africa is moving towards subspecialization, and we have the capacity and capability to do it. And, just being able to bring in the funds and allow for people to do the subspecialization. And it's amazing to hear that it wasn't just one global partner. It started with one global partner, but also other global partners came in and supported, the 3 of you to begin with as you started your training. And that's fantastic to hear. And is that something that's still available even up to now, or has the funding structure changed? Because I know a lot of the people who listen to the podcast are like, has it changed? Is it still the same? Would I have the same chances that, that you had?
Yes, the funding has actually remained the same. The WFSA still funds at the level at which it used to. The way of funding has become that once the fellows are enrolled, then specific organizations pick the fellow they are going to fund from the start. So this has released money from the WFSA to be used somewhere else where we have got other global partners coming in. So the funding with the school fees, the stipend, travel, workshops still remains the same.
And I love the fact that you said that the kind of exposure that you had, it wasn't just in the center you were working at or employed at, but then you had within the country 5 other places that you went to, and a step further, and you were in the US as well, to be able to get even more training. That to me is so amazing, because the lengths that you and your colleagues went to be able to get this additional skill is amazing. And as we're talking about funding and what the experience was like, as a family person, how did your family take it when you said, I'm going out, I'm going to be able to do this fellowship? What was their reaction to it? And how did they respond to you now starting out the fellowship?
Yes, support from family was very good. Actually, when I started applying for the process, that was June, I had a 7-month-old baby. And the other one was maybe, 7 years. that actually had been when this particular fellowship wasn't a process, that is my biggest challenge, was how am I going to organize the family. But when it became a local fellowship, that was very easy to discuss, knowing that already I was leading a very busy life as an anesthesiologist, and I had already put in place mechanisms to support me in terms of family, taking care of children. So because there was no much change in location, I was getting funding, so there wasn't going to be much strain on the income available to the family, then that made it very easy. In fact, the assumption initially, we couldn't tell how much work we were going to have, because this was just starting. But by the second month, it became very apparent that the workload was so much. So social capital, I had my siblings, my sisters, my younger sisters actually came in very handy, and one of them came to live in with me, especially helping to take care of the small baby when I had to travel. And I must say, again, the stars were shining on me. I had no much difficulty rearranging my family, as opposed to if I had to go away from the country. And that is, I guess, one of the biggest sell points for having a local fellowship training within your country.
Shout out to your family and the support that they gave you, for your siblings being able to step in and be able to help. I can't imagine having a 7-month-old and a 7-year-old, and you're starting out your fellowship. And even if it was in the country, it still was very busy and also balancing your other roles in life. So that's so amazing. Let your family be given their flowers now. We
Yes.
really, really appreciate all of you. I hope they'll listen to this episode.
Yes, yes.
Yeah. And you've mentioned, as a mom, as a woman, there's a lot of misconception around some of the subspecialties and the strains it would have on you and your role as a woman in the community, in the home. What do you have to say about anesthesia as a specialization and pediatric anesthesia as a subspecialty? What would you say to someone who's wondering, I'm a girl or I'm a woman, how will I do this? What would you say to them?
I guess one of the very important things is if you are thinking about subspecialization, you've got to search your heart very much, because the investment in yourself and what you're going to do for 1 to 2 years during training is very intense. You've got to think very, very clearly as you search, and think about what you really like, because this is unlike the earlier trainings, a subspecialty actually becomes a part of you. So having or working on something, going for training in something that you're passionate about becomes very, very important. And sometimes there is a need and you'd like to fill the need, and maybe you don't have so much passion for that particular gap. If you can create passion, then create passion and go for it. Because also the other important thing is you want to train in something where you are coming to fill in a gap or answer a question that has not been answered. That way it gives you a lot of motivation during the training and when you come back. And balancing life with family, and when you're deciding to do this, is important to have your conversation with the people close to you and let them also understand why you want to do what you're doing. Again, at this level, it's not just about you, it's also about the people around you. So when you have buy-in from those around you, then the support, or rather the journey during the fellowship, becomes even easier. So for those who are thinking about family, I have children, I am a woman, this is very possible. And remember, sometimes if you don't take the bold step to do it today and you still linger on with the if, should I go, should I not go, the if remains. So the earlier you make a decision, once you have it as a thought in your head, the better for you. Actually, probably things never change unless you now take the next step.
No, that's great. And, it's just amazing to be able to hear that. It sounds like the training itself, it had the in-country and it had the out-of-country experience. And so now you've told us there are these children, at least you have your support structure, and you are in the US for some time. What was that experience like switching from the Kenyan medical education sort of structure to a US structure in terms of building your skills and building your knowledge? What was that experience like?
It was actually a very wonderful addition to what I had already done locally. I usually say probably because I went at the tail end, already knowing what pediatric anesthesia was, and I had interacted with faculty from the US already, then that opened my mind when I went there for 3 months. I exactly knew which are the areas I wanted to get more exposure on. And as I had said earlier, we tend to have a very extensive mix of patients who probably you will not see in places like the US, very sick patients coming very late. And that gives you quite some grit and some experience that is not there. So you go there and you have something to share with the fellows there, with your faculty there. So you meet the same patients there, but with very different stages of disease. So it was a very, very good addition to what I had already learned. The transition, again, what was the initial struggle was actually getting the paperwork to go there. But because of the international partners we had, this was actually made easy for us, and the processing started early, but it required a lot of paperwork. And luckily, we had networks that actually opened ways very easily to very good institutions in the US. After the fellowship, I actually ended up going back to the same institutions every year on now a teaching mission. Yes.
That's really exciting to hear that it wasn't just learning, but then you're also having these opportunities to teach after that. Apart from the learning and the skill training, were there any additional courses that helped build you up further and prepared you for this job market where you are going to be this rare commodity? Was there anything additional outside of the pediatric anesthesia training that was complemented or built into the training program?
Yes, we had to go through a training in leadership. One of the main objectives of this particular fellowship when it was being rolled out was that they wanted fellows who would come, get trained, and then go back to their various institutions or countries and become leaders, either in medical education or in clinical practice. So we had training, a 2-week training in leadership, clinical leadership. So this was meant to equip us in going back to take leadership roles. And then secondly, the other main thing was to make sure that we were equipped with the skills in teaching around the clinical areas. So again, there was a training in medical education, how to teach adults, how to teach in clinical areas. So you basically came out, even those people who had not had experience in medical education, you came out and you were quite equipped with going back and mentoring others and training others around pediatric anesthesia. Yeah.
The more I'm hearing about the comprehensive sort of like 360 look at, the fellow and, leadership being one thing, being a teacher, and for sure, just being able to see the fruit of that in so many different ways has been really, really amazing. Because I remember when we were finishing undergraduate and how some of our colleagues after finishing internship were put in leadership positions that, you are not trained for, and suddenly you're hearing someone has become a med soup, which is the medical superintendent, and you're in charge of a certain particular area. And, years, forward, now hearing that, there's intentionality around ensuring people get training in leadership, training in teaching adults, because as an adult, I think training adults is like herding cats sometimes. And maybe this sounds really, really bad. It's not like training children, and it's not just rote, just memory and things like that. It's helping them get flexible in how they think about problem solving. And so that's amazing to hear that this was invested in you as a fellow. Talk to us about, I know in terms of transitions, you seem to be a person who weathered transition from country to learn really, really well. Tell us about going from being a leader and becoming a student, and then what you transitioned to after you finished. Could you walk us through what that transition experience was like?
The transition, yes. I had been a faculty at the same department where the fellowship was going to be domiciled for about 6 years. So I had been teaching, and I was working almost in the same environment where I was going to do quite some work as a fellow. So for me, one thing was, it was a gift because familiarity gave me a lot of easy landing. Colleagues you have been working with, the working environment you understand. So that for me, there was no time wasting. Once the fellowship started, the work started. But again, I used to ask myself, am I going to actually find anything different? Am I going to grow? I have been working in this particular operating theater, probably giving anesthesia to children. What is different? So luckily, I have always kept a mindset of learning as a continuous process and the openness that you can learn from anyone. It became very exciting to learn something new every time, and especially when you are actually being taught by experts now, and some of the things you believed were truth were actually rubbished, and now you are being told the truth because you are being taught by people who are experts, and you can actually see there's a difference from what I used to do versus what is being done. So I got absorbed. The work was a lot. I got absorbed and actually became a student completely because I had to put down the mantle of now being the leader in where I used to work before and be a student, and that worked. So basically is having the humility to let yourself be in the mindset of learning from everyone and at every encounter. And then now came the other part of it. Now you have finished your fellowship and you are transitioning back to where you are supposed to work. So again, this was a bit challenging because when you go back, people receive you at the same level you used to be. But now you have to prove to yourself first and to the rest of the people that you have come back with something additional. Okay? How the fellowship helped us is that we were equipped, as I said, with some roles in leadership. And secondly, what we decided as the fellows and part of the program was that as you go back, so that you don't lose momentum, you pick one project you want to run with within the first 3 months of reporting back. And this project should be something you have seen in your institution that is completely off, and you want to get it back to the right direction when it comes to pediatric anesthesia. So that kept us in contact as fellows. And actually, each one of us picked something in their institution and in their country, and we could exchange notes. And that ensured that we did not get lost back into our usual work. So again, the patience with yourself and patience with others is very important. So I always tell the fellows I interact with now that you've got to start learning how to be consistent in very small things during your fellowship. Yeah, am I going to start doing this thing every other single day? That is the only way. Otherwise, you can get overwhelmed and get absorbed with what else is going around you.
While you were doing all of this, what helped, in terms of your mental health? Are there some things, some strategies that helped you? Because I can only imagine the kind of caseload you had, the variety of patients, the emergencies. That's quite stressful. So, what helped with mental health?
Yes, I had the most wonderful classmates I've ever met. We were 3 of us, but we were a class full of all characters. One of my classmates was a guru in ensuring there is balance from work. Yeah. And we gelled in so well. Actually, one of them had the same age of a baby like myself. When we realized that, we supported each other very much in terms of just sharing. I went home yesterday and I found this. Yes, so just having somebody who is going through the same experience and also having the same challenge at home, that helped me a lot. And secondly, we worked as a team where we actually covered for each other. And when somebody had to attend to social issues, when somebody was unwell and overwhelmed, actually the two people would actually take the duties and we would cover each other in that way. And the most important part of it was every 2 weeks. Yeah, we had one of my colleagues whose husband was very supportive. Every 2 weeks, he would call all of us and say, you guys need to go and do something that is not pediatric anesthesia. And when I take you out, I don't want you discussing about anesthesia. And one of my classmates was very good at karaoke. So we would go and she would sing and we would just relax and then go back to work. And also maintaining the other things that had been going on in life, spiritual life, that you still ensure that you get your spiritual nourishment in whichever way you are used to. And ensuring that routines at home are not disrupted because you're not there, because those routines at home, especially around children, can throw you back so much. Yeah, and for me, as I said, I had a lot of social capital that sometimes when I just needed to breathe, my children would be picked by my sisters, taken wherever, and I was led to be. Yes, and I had also a mentor who was very supportive all around, just knowing how to prioritize. It can never really be a balance. Prioritize what needs to be prioritized today. Do you need to prioritize finishing your assignments today? Then that needs to be dealt with. Do you need prioritizing to be with the children this weekend more than anything else? Then that needs to be prioritized. And then that way you just find each day things run and the year comes to pass and you're fine. Yeah.
I absolutely love that. Shout out to your cohort and your
Yes.
cohort's partners as well in
Yes.
terms of maintaining that balance.
Okay.
That goes a huge, huge way, because I think in medicine, we're so focused on the academics a lot of the times that, just having people who give you those pockets of rest or pockets of just, we're not studying today, we're not having that right now, we're just going to chill or we're going to do karaoke. So I absolutely love that. And thank you so much for sharing that. In terms of just being able to be, where you are right now, what are some of the words of advice that you would give to somebody who's thinking about an anesthesia fellowship?
Yeah, my words of advice would be, I actually encourage as many people as possible to go for fellowships. They actually make a big difference in the way we practice. First, find out what you are passionate about. There are people who are passionate about things from very early. There are people who require a longer time in practice to touch everyone and finally find their path. And then do your homework very well. And the homework is all round. How is this going to affect you as an individual in terms of, will you have to transit from where you are? Is there an alternative of you having to, training within your locality? How is that going to affect your family? How is that going to affect your career as it is? Because sometimes you find people have to resign jobs to go for fellowships. They are not given a choice of study leave. So, and also think about from the start, what do you really want to do with your fellowship knowledge when you come back? Because one of the most frustrating things becomes that you're back, you actually don't find purpose with what you went to do. So identifying the gap you want to fill and actually creating the pathway early in advance, even before you go, is very important. It gives you a direction when you come back. And go with a mindset of openness to learn, even if you're a seasoned practitioner. Because I think most of the time what holds us back is when we keep on telling ourselves that I'm going to do pediatric anesthesia, but I have been anesthetizing children for the longest time. There's always something to learn. There's actually a lot to learn when you learn in the right environment. And you actually become a different person. Even you yourself can actually put ticks on, I used to do this, and now I do it differently. I can never do what I used to do before because it was wrong. And for those who are probably already in fellowships and are almost finishing, believe in yourself. You have been trained. Believe that you are a specialist and actually live it. That has to be something you carry with yourself every day to help you actually land back and be able to do what you're supposed to do. And for pediatric anesthesia, I always will encourage those who have done pediatric anesthesia as much as possible, come back and do pediatric anesthesia, because I've seen quite some examples of people who come back and they still end up doing a lot of adult anesthesia and their pediatric work fizzles off. There's a lot of pediatric work that is required. So when you're a specialist, be patient with yourself, be consistent, and let us serve the children that we actually went to train to serve. Yeah.
I absolutely love that. As you're speaking, I'm here writing notes, I'm nodding, I'm saying, yes, this is the Susan sauce. This is the Susan sauce. But I absolutely love, you've consistently talked about consistency, being patient with yourself, believe in yourself, and, being able to pave out a pathway even before you go, knowing what you're coming back to do. I think those are such amazing nuggets of wisdom, which we really, really appreciate you sharing with us. And I'm just wondering, is there a way, if the listener wants to be able to get in touch with you, be able to ask you more questions, potentially even ask for mentorship, is there a way that the listener can be able to get in touch with you, either an email or a social media handle that you can be able to share with us?
Yes, I am available for questions, mentorship, and also just partnering in the pursuit for surgical care of children in this country. So they can get me on my email, nabulindosusan@gmail.com. And also on LinkedIn, I can be found as Dr. Susan Nabulindo. Mm-hmm. And also Facebook, just Susan Nabulindo. Yeah.
Oh, that's fantastic. And I will make sure that I put it in the show notes so that people are able to reach you directly should they have any questions. Thank you so much, Susan, for being able to take the time to talk to us about what your journey has been and, the experience that you have had, which was so rich. And we hope to be able to hear people's responses and, what your reactions are to hearing about pediatric anesthesia as a subspecialty in Kenya. And, looking forward to being able to interact with those responses. And until the next time, bye. I'm so glad you stayed tuned. Please get the word out and share it with at least 3 people. Make this episode like a chain letter. Share it, share it, share it. Come back for the next leg of our safari, where we'll be talking about.
So your task is not only to provide services, but to mobilize the resources that you can use to provide services. And these resources are not only equipment and supplies. No, it is also human resource. You might need to train your nurses. You might need to train colleagues so that they can support you in giving that services. So that's an important aspect that people that are training for subspecialty and they're going to be pioneers to bear in mind.
Listeners are advised to use their own judgment and discretion when applying any information discussed in this and all podcast episodes to their specific situation. Always seek the advice of a qualified professional if you have any concerns or questions regarding a particular subject matter. You can find this and other episodes of this podcast on our website at www.fellowshipsafaris.org. You can also find all our episodes on all podcast platforms. Reach out to us on social media as Fellowship Safaris on Facebook, Instagram, and TikTok, and our Twitter handle is @fellowshipsafar. You could also send us an email on fellowshipsafaris@gmail.com. We look forward to hearing from you and interacting with what you have to say about the Fellowship Safaris podcast. It takes a village to make this podcast. The executive producer and original music is done by Mokavi Maweu. The sound engineer is Tevin Sudi with thanks to AQ Studios. Graphic design was done by Benjamin Mboya. We would like to give a special shout out to Josephine Karianjahe and Melissa Mbogwa of Africa Podfest. All rights reserved by Dr. Njeri Karianjahe and the Fellowship Safaris podcast.